We are a chosen generation. We've been called for to show His excellence. Hey, all I require for life, God has given me, and I know who I am. We are a chosen generation. We've been called for to show His excellence. All I require for life, God has given me, for I know who I am. I know who God says I am.
Good morning, good morning, good morning. Today is the day the Lord has made, and I shall rejoice and be glad in it. Amen. I am Elder Maxine Freeman, and I am the co-host of Living Springs Women Empowerment TV show. Today, you can see our host and founder, Dr. Flora Gooding Davis, is not with us. She had a prior obligation, and that's the reason why she is not here. Therefore, I will be hosting solo today. So keep me lifted in prayers. Today, I have a dear person sitting next to me. My niece. Is an honor to have her. I'm going to do a little intro, and then you'll learn more about her during the takeaway. As you know, we've been doing trending topics. We did domestic violence awareness, we did breast cancer, we did health and wellness. Today, we're going to be talking about mental health. She's a mental health professional, and so let me go ahead and just give you a little intro. Our special guest is a graduate of Bowie State University with her undergrad in social work. She went on to further her education, obtaining her master's degree from D. Morgan University, which is a family university. We have 5 of you from there.
Yeah.
2 PhDs, okay? Let me not brag.
Yeah.
She has worked as a mental health professional for the past 6 years. She currently works at the Department of Social Services. She has a passion for serving vulnerable and marginalized individuals in the community. Therefore, she went ahead and dived into this career path. She is dedicated to the field of mental health, enabling her to make a meaningful impact in the lives of these individuals. Let's welcome to the show my niece, Mistress Love Gonga. Welcome to the show, Love.
Thank you, Elder Maxine.
It's a pleasure to have you.
Thanks so much for having me on the show, and I'm really, I feel blessed to be here and just to be a part of everything you are doing and everything the Living Spring Women Empowerment is doing to help empower young women like us, and let us know that you acknowledge us, and there's a platform where you can share this with us.
Definitely, yeah. Just by your mere presence is going to empower women in your age group. You have accomplished a lot for your age, and we'll talk about that as we go ahead with the show.
Thank you.
So, Sister Love,
Yeah.
let's define mental health. I'll go ahead and define it, and we can just start the discussion.
Okay.
Mental health is defined as a person's condition with regards to their psychological and emotional well-being. The following are some of the causes that will alter your mental health: childhood abuse, trauma or neglect, long-term stress, bereavement of a close family, bereavement of a job, bereavement of a home, and so on and so on, and social isolation. Take any of those or anything else that you may want to use that's not mentioned and tell us how they can affect a person's mental health.
Okay, so in regards to events that could alter a person's mental health, when you look back at the history of mental health, people who did studies, theorists, Sigmund Freud did talk about adverse childhood events in one's life and how it could possibly have a negative or positive, impact on the person's life in their adulthood. Mm-hmm. So based on his research and based on the the research I did, just reading about this during school and just through work, there's a close tie to what he spoke about and what his theory posits. He said that, if a person has adverse childhood experience, there's a possibility that experience will have
Lead to mental health.
Yes,
Yeah.
and it could lead to different type of issues, mental health issues, behavioral issues, and so we've seen it happen in different circumstances where people, we've seen a lot of cases on TV about why people do some of the things they do. And
Like mass shooting,
Yes.
for instance.
Exactly. So we, as society, we can't phantom the idea of what caused this to happen. And so when we go back and do research and we see that, oh, this person had this experience growing up and this happened to them. And sometimes it could seem to the public like, they're trying to make up excuses.
Right, to get away with
to
it.
get away with their behavior. But these things does have influences on a person's behavior or how a person's even build their personality growing up into adulthood. And so that's why it's very important that we, bring awareness to mental health and, self-care, how we take care of ourselves. Our mental health is just as important as our physical health.
Or even more.
Or even more.
Even
yeah.
more, because
And we pay so much, we invest so much in making sure that we are physically, okay. Our physical health is okay. We do periodic checks with our physicians,
And they pay money going to the gym.
Right.
People, it's like a crazy, people are going to the gym in the morning, going to the
Yeah.
gym. But how is your mental health?
Yes. Are you really paying attention to yourself? Are you taking care of your mental health? Because eating right is just as important as
checking your mental health.
Yes. So,
Yes, and because without your mental health, you cannot take care of your physical health.
Right.
Because you have to be in the right frame of mind.
Right.
That brings us to some symptoms. As a community at large and a society obligation, we need to be well informed. And like you say, do research, because Maslow talks about the hierarchy of life.
Right.
And those are one of the things that needs to be met
Right.
before you can get to self-actualization.
Sure, yeah.
So the mental health, where you live, so on
Right.
and so forth. As a community, we need to be able to identify if a colleague or a family member is experiencing some mental health issues and then be able to reach out for resources. These are some of the symptoms that when I did my research for the show, you would see an individual feeling sad,
Right.
down, extreme mood changes.
Right.
1 minute they're happy, 1 minute they're sad, 1 minute they love you, 1 minute they hate you.
Right.
As a mental health professionals, what are the first steps? How can we as family, community at large, how can we safely approach these individuals? What would be the key script? I mean, if I notice my coworker is going through these changes without being offensive, how can I approach her safely or him?
I wouldn't say approach the person directly.
Correct.
However, you can have a conversation about, like you can check in on that person.
A conversation, yeah, that's the
Yes,
key.
yes. You can
Not
have-
art, not
yeah.
not. I can't go and say, oh, I think you're having mental health. No,
that wouldn't be the
That's what I'm
ideal
asking
thing
you.
to do.
Yeah.
Because we still have to respect the dignity of
the
our
privacy.
privacy and dignity of our colleagues, our peers, and however, what we could do is if you sense any form of like mental health breakdown or behavior changes, abnormal behavior, what you could do is check in with that person
Okay.
Yes, it's preferable to check in with that person and just have a conversation about, are you okay? Is everything? And if you create that safe space, you never know
Trust.
that person could be comfortable with disclosing
Definitely.
to you. However, most people, because of privacy and also the stigma that is attached with mental health, we're not having these conversations openly, especially in our community. We are not,
Definitely, African American community.
right. We're not comfortable with having these conversations, and so we tend to shy away from it. We tend to, it seems like a taboo. And even when people are diagnosed with stuff, they
Hide it.
They hide it, right? Because you do not want people stigmatizing you or putting a label on you that you're this or you're that, because you're not what you're diagnosed as. It's just we all have mental health issues.
All of us.
We all struggle
on
with-
different spectrums.
spectrum,
Yeah,
different
different
levels.
spectrums, yeah.
So we just coexist and find a way to deal with our mental health issues. We self-care. We do things that will help.
We go shopping.
Yeah, yeah, that
And
helps
we go
a lot.
shopping.
That helps a lot.
We
That
get
helps a lot.
Starbucks.
Yeah.
Yeah,
Yes, I'm a
that's
shopper too.
yeah, that is very interesting. What I want to talk about, when things happen, when there's a mass shooting, and then people say, "Oh, I always knew that she had these issues." As a community, is there in the national database a number that we can call? We cannot report or make an adult seek help.
Right.
But we need the support. If we're thinking something's going on, does the country have like a database for mental health that we can call and say, my coworker is showing these symptoms, and then they're the expert. Is I know for domestic violence they have that national
Yes,
number.
yes.
So does mental health have a similar
So
national number?
So I'm not sure if I would just attach it to mental health. However, if you notice a family member or a friend is having a mental breakdown, you can always call, 911 and like report what you are observing, and it'll be like an ambulance or somebody will be sent out and they'll evaluate the person if they need to be evaluated at a mental health facility.
Or at that point?
Yeah, they'll make that transition. Also, I know for there are other hotlines where you can call, but I'm not aware of a number you can
Of a
just call and
national.
say a national number and say, like you stated earlier, it could be in the case of domestic violence, we have a hotline, suicide prevention, we have a hotline, for
They need to
that.
get one for mental health.
Yes.
Because it's real.
Yes, so I'm not aware of that, so I probably need to do my research around that. But I know you can always call, a non-emergency number, depending on the severity, because you never know if a person is having a mental breakdown. So you always want to first do rule out medical issues.
Definitely.
You want to have the person being seen
Evaluated.
by a physician or a doctor, and they'll be able to know if these symptoms are, mental health related or if they're medical
related.
symptoms. Yeah.
Yeah, that's a gray area because it's been on the rise where you call for help for a mental health crisis and it goes bad.
Right.
It goes bad. So a lot of people may shy away from there. But I think from our conversation, the key is education.
Right.
Yeah.
Awareness, education. I think it helped. What I do know is, just to piggyback of what we just talked about, there's a crisis intervention line.
Okay,
Yes,
okay. So there's a
the
crisis.
crisis
It can be
intervention-
any kind of crisis.
If a person is in crisis for whatever reason, especially mental health, they'll respond. And if that person needs to be transported to the hospital, they have a team that they respond with, and they'll be able to do a quick evaluation and then take the person to, if it's a psych ward or a mental health clinic, whatever they determine is the best for the person at the time, they'll have them, Yeah.
Because I know being in the health field, you can self-admit or you can be admitted by
Yeah,
two physicians.
non-voluntary, yeah.
by two physicians.
Yeah.
And I think you have to stay for like 3 days, 72 hours. They want to make sure that you're okay and you're good to go.
And just to add to that, also, if you're a spouse of a person, you can file a EPS. You can always
EPS
file
for our audience.
That's like
Emergency.
petition with the court or the judge to be able to have that person evaluated due to the symptoms they're displaying and you've observed.
Okay.
Yes,
And-
it could
and-
be non-voluntary or
Correct.
voluntary as well.
Okay.
Yeah.
All righty, and we do have quite a number of hospitals with mental health units. University of Maryland, right here in Largo. I believe Washington Adventist has one.
Right.
And of course, we have Shepherd Pratt.
Shepherd Pratt.
Shepherd
yeah.
Pratt is the facility of all facilities.
Right.
It's real fancy,
Right.
and it's usually for people on longer term or short term. It's mixed.
Yeah, they do have long-term and short-term program at Shepherd
Shepherd
Pratt.
Pratt.
Yes, I'm aware of that.
All righty.
Yeah.
So I hope you're getting your nuggets. This is Mental Health Awareness Month. This show is going to air early in November, but we're capturing this in October for Mental Health Awareness Month because it's important that you know what is available to you, how to access it.
Right.
Let me pick your brain here a little bit. I'm not a mental health expert.
Right.
So, Sister Love, there are 3 most common types of mental health disorder. The clinical depression, which is characterized by persistent depressed causing significant impairment in your ADLs, in your activities for daily living. Anxiety, feeling worried, always anxious, like something's going to happen. And bipolar,
Right.
the big one.
Yeah.
Bipolar disorder mood swings. Take any one of them or all 3 of them and just give us a little snippet of what they entail and how the professionals would approach treatment.
Okay, so as far as anxiety disorder, which is like GAD, it could be GAD, general anxiety disorder.
I was going to say, break it down
Yeah.
because we don't know that.
Yeah, is when a person, according to the DSM, this is not me. So there's a DSM-5 that therapy.
DSM is
is
disability.
diagnostic, yeah, criteria,
Oh,
something for
okay.
diagnosing.
It's like the ICD-9 code for healthcare
exactly.
professional.
That's what
Okay.
it is. The DSM-5. So the DSM-5 has all the criteria or the symptoms that will fall under the criteria for a psychiatrist or therapist or mental health professional to be able to diagnose a person that's displaying these symptoms for wherever the diagnosis is.
So they would determine from the symptoms
Yes.
what it takes for them to be considered as having anxiety disorder.
Right.
Or what else did I say?
Or bipolar.
Bipolar.
Yeah. For instance, with bipolar, because we have bipolar 1 and bipolar 2. Let's use bipolar.
Well, we getting ready to get some nuggets.
Yes. So we have bipolar 1 and bipolar 2. So
Okay.
Bipolar 1, there are symptoms and time frame that has to meet the criteria of the DSM for a person to be actually diagnosed with bipolar 1. So with bipolar 1, it's a more severe kind of bipolar. The person has to display symptoms like manic symptoms for consistently a week.
Okay.
Yes. And for bipolar 2, they have to be hypomania, and that is less severe.
So let's break down. Bipolar is a behavior that is it's a behavior that is not within the norms.
Yeah, it's a psychiatric.
It's a psychosis.
Yeah, psychosis, right.
Okay.
So now, persons with bipolar 1 would display risk. You could see risky behaviors, gambling.
Okay.
It could be
Reckless.
reckless and risky behaviors. So that's somebody who will take their last money, go spend it. You know, they have these grandiose ideology that they're
Bigger than who they are.
yes, and they
They're King Solomon.
yes. So you know, something of that nature, and they'll come up with these. They'll get involved in risky behaviors. Their decision making.
They'll go skydiving.
Yes. So you'll see less of that in someone with bipolar 2, which is the hypomania, and they'll have some of those traits, but a little less than what bipolar 1 will be displaying.
Okay.
Yes.
And they can only be labeled that with proper diagnosis. Within the constraint of your
DSM-5.
DSM-5.
Yeah, and a licensed or a psychiatrist, a licensed therapist or a psychiatrist will be able to pin that out and diagnose that person if they're displaying these symptoms as per the DSM-5.
Okay.
Yes.
Wow.
So it's all laid out right there for the therapist.
Well, it's easy
the
for you because you're a
psychiatrist.
professional.
Yes.
You're
You can be able
professional.
to see, and you definitely can see based off the presenting problem that the person is talking to you about.
presenting with,
they're
okay.
presenting with. You will be able to, even if you're not sure, you can always relate back to the DSM-5. Like you said, in nursing is
We have the ICD-9 code.
Yeah, the ICD-9 code. Yeah.
Okay,
That's
so
right.
viewers, I hope you're getting those nuggets in. We are going to just take a brief break and give you an opportunity to listen to our testimonials. We have testimonials, new ones that we'll be uploading for the next upcoming year. We're almost at the end of our fiscal year. Those of you who's been with us from the beginning of this journey. So we're going to stop and we'll be right back. Don't leave. We'll be right back.
I had a dispute with a company regarding work to be performed, which didn't end well, as per the contract. I filed a fraud claim against the company, but was denied. I went to the mountain and prayed for God to intervene. Within a week of my return, I received a letter from the financial institution that my claim was received and will be awarded the full refund, which is thousands of dollars. To God be the glory for this praise report. Revelation. I had just arrived home from our women's retreat and dozed off for a few minutes. I saw in a closed vision that I was presented an award from this particular man whom always dressed in radiant white glittering clothing. I called this man my angel and Holy Spirit. He presented me with an award with my name etched on glass and other inscriptions. He was thanking me for a job well done. I dozed off again, and the same man was giving me specific instructions to write a book. He was detailed as to giving me the name and chapters of the book. There are other revelations that will be testified as they unfold. God saved 3 of my children from 3 separate automobile accidents. Pastor Flora called me to participate in the Women's Empowerment Prayer Group and informed me about fasting and standing in gap for our children. My inner spirit bubbled, not knowing that I was planning to embark on a fast 7 days for my children. My second daughter was involved in an automobile accident on August 2022. The third accident occurred involving my third daughter on October 2022. I gave God all the glory that despite their cars being totaled, none of them were injured. The devil continued to steal, killed and destroyed, and brought confusion to my place of employment. 3 employees ganged against me to destroy my reputation. I presented the issues on the prayer line, and the women stood in the gap with me. 2 of the 3 people resigned their employments within a few weeks with no concrete reason. The 3rd person confessed their plot to me and asked for forgiveness. God set confusion in their camp and are currently blaming and fighting each other.
Welcome back. We are back. I hope you had an opportunity to listen to the testimonials. And like I've been promising you since the last couple of shows, we do have some new ones that we're going to be uploading. And just remember, you also will have your testimonies. So we've been talking with our special guest, my niece, Sister Love, who is a mental health professional. She's been giving us some nuggets. And I think when we took our break, we were talking about the 3 kinds of mental health: clinical depression, clinical depression, bipolar,
Right.
and I forget the 3rd one.
It was anxiety.
Anxiety.
Yes.
So now she's giving us a little information about the 3 different kinds, and we talked about the 2 kinds of bipolar.
Polar, yeah.
As a professional, what are the treatment approaches for those? Are they counseling? Are they group sessions? Are they medications? How are those depressions treated?
So based on the knowledge that I have, if a person is diagnosed with a mental health, let's use bipolar for instance, right? They will, the psychiatrist or the therapist will determine if the severity of what treatment that needs to be provided to the person. But I know for sure, because bipolar is a psychosis, so they will definitely recommend medication treatment. And if the person is open to therapy as well, that's something that they will
Talk
recommend.
therapy.
Yeah.
Okay.
Yeah, they will recommend. And you know, I'm not sure about counseling as far as with bipolar. However, there are other mental health issues where you can, disabilities, I'll say, that you can, utilize group counseling, or if a person is dealing with substance, alcohol, they can always be referred to.
Oh, you're
group
saying in
counseling
conjunction with being diagnosed
yes,
with bipolar.
Yeah.
Wow.
No, or if the person is just strictly dealing with that, because that also is considered in itself as a mental health
Definitely.
issue. So,
Definitely.
and sometimes could be treated also with medication as well. So there are anti-abuse medications that they use to treat people dealing with alcohol, substance issues, and there are like group counseling they can participate in as well. So it just varies based on the diagnosis and what the person is dealing with.
Yeah, a year in review, a couple of years in review, as we look back, there was a rise in mental health during the pandemic.
Right.
Did you guys find that in your career path? Did you have a lot more people coming in with mental health issues or being diagnosed?
Yeah, there was an increase in mental health issues, child abuse, domestic violence. A lot of that, we saw a high increase in it, and it was just because, humans, we're social beings. We're supposed to be out, we're supposed to be about doing things. However, COVID had us in a stagnant place, and we were all isolated, yeah. So the children were not going to school, they were staying home, parents were overwhelmed. There was a lot going on.
And food insecurities.
Yes. and people were stressed out. There was a lot of stress, anxiety, in these homes, and the rate of getting a therapist has increased, and
The availability.
the availability.
I
of
think I'll go to school to be a
therapists,
therapist.
Yes.
Yes.
Yes. So it really was a struggle during COVID. However, we have also seen the numbers go down because people are getting
Back to the swing.
yes, and not just that, but people are getting the help they need right now. There are a lot of therapists coming up, getting licensed, and so the resources are out there, and people even now. So I have clients who still, find it difficult to get access therapists because the need for therapists has gone up so high.
You know what I find such a disparity? When you get your health insurance, mental health is given the least amount of
Right.
of money. They'll tell you can have 5 visits a year.
Right. Right.
They're predetermining how much mental health you need.
Right.
And I think we need to do something about it.
And that's why we're here today,
Yes.
having these conversations.
Yes, and hope somebody out there hears
we're
it.
raising more awareness, and because we have joined voices with the thousands of people around the world who are letting the world know that mental health
It's
awareness is
important.
very important, and because at some point it was like a stigma, people
taboo.
were not a taboo, people are not open to talk. It was never prioritized as our physical health is prioritized.
Yeah.
And this is just as important. I can't stress that enough. Your mental health is just as important.
It's the beginning of your everything.
Yeah, everything stops once.
Once
your mental health is not okay, everything else stops.
Definitely. You
Yeah,
will never
it
reach
ha-
Maslow's
yes,
hierarchy.
Yes.
We learned that in nursing school too.
Okay.
Okay. Let's talk about the most serious outcome of untreated mental health, suicide.
Yeah.
Statistics tells us there are 132 suicide deaths a day in the U.S. Suicide is the second leading cause of death next to homicide, next to people getting shot.
Right.
Suicide. Okay. Men die by suicide 3.90% times more than women. They die physically, but women, we die emotionally. Trust me.
Right.
We're dying.
I can agree.
Yes. So suicide ideation is when a person wanting to take their own life.
Yeah.
There are 2 kinds. Active, the person that says, I'm going to kill myself, I'm going to kill myself,
Right.
and they're formulating a plan.
Yeah.
Then you have the passive suicide threat person.
Right.
They'll talk about it, but they don't make any plan. As the community at large, members, friends, so on and so forth, we talked a little bit about it. How the resources, we talk about the crisis hotline. So as a professional, if you have a client that you made a visit on or you had a session with, and they exhibited either one of these suicide ideations, what do you do?
So, as you stated earlier, a person can state, anyone can say, I want to kill myself,
Okay.
or verbalize being suicidal. What I, as a professional, what I want to know is, how do you plan on doing this?
Okay. The active one.
Yes, the active. How is there a plan? If they're telling me I plan on doing it this way, or I plan on,
Jumping the bridge.
or putting myself in a hanger, or trying to hang myself, then I have a firearm at home, and this is how I plan, or I have medications I plan. So immediately I know that I have to make that call, and this is when I'll call crisis intervention, or I'll reach out and get help for that person immediately. I will not let that person out of my sight without,
Some intervention.
Intervention, yes.
Okay.
Yes.
Now, how do we handle the talker? The talker, you can use that. It's not funny, but you can use it. There are people that said, "I'm quitting my job.
Right.
I'm quitting my job."
Right.
But there's
But
no
never
plan.
find-
Their
yeah.
resume is not out there.
Can't find
So
the
then you have a
courage.
person that's saying, "I'm gonna kill myself."
Right. You just want to assess and talk to them more and try to figure out what's causing them to say what they're saying, and if there are underlying issues that's causing that person to verbalize what they're saying to you, and is there anything you could do to help, support that person at that time, because until the person is, you'll also keep an eye on that person if they're your client, that individual. However, if the person is not telling you how they're planning on doing this, there's not a whole lot. You can still reach out to crisis intervention. However, they're still going to ask you,
What do they plan on
what
doing?
are the plans? Yeah. Does they have this person? Did they report having any plan to implement this? What they're saying to you, and so they'll still get evaluated. They'll be taken in, but
That's a gray line
Yes,
between getting
yes,
help
that's where it's
and
at.
being a nuisance.
Right.
It's a gray line.
Right.
Yeah, so let's talk a little bit about children. How does mental health, we talk about how when you're a child and what you experience impacts your mental health as an adult. But let's just talk a little bit about the impact mental health have with children of parents with these issues. What do you see when you do have clients who have mental health and have small children?
Okay, so a person having a mental health issue does not automatically determine their parenting skills.
There you go. That's what I wanted to hear.
Yes, it does not determine their parenting skills. A person dealing with such issue, you want to assess and see what their capabilities are, what their abilities are, what challenges they're dealing with as far as when it comes to parenting, and you want to provide support in that area. And you want to also assess and see if they're having support system. There are people who have mental health issues, but they're able to deal with their ADLs. They're able to, care for their children. They do not have challenges or
Outside.
raising their children. They might have it, but they find ways to manage those challenges. Some could be managed using medication for, managing their mental health issues. Once they're on their medication, they're fine. They're able to take care of their family, go to work, and be, normal people in society. So it really does not determine your parenting skill. However, you can use some support resources that are available to you just in case you might need it.
Okay.
Yes.
Let's talk about your passion. You have a lot of passion for the less privileged, people who are marginalized. And I can see how the stigma of mental health sometimes puts citizens, individuals, in vulnerable position.
Yeah.
And I think your outcome, you want to impact their lives, that they become part of the community.
Yeah.
Have you done any outreach programs? Have you been a part of any outreach program? Do you have anything on a burner that's going to encompass this? Or how do you see us as a community doing this?
As far as a community, what I will say is that I think we're in a phase and stage of growing, where being open now to conversations that we never had in the past, things that we never shared light on. It was considered a taboo, as we have talked about earlier. But now we're in a space where I can see a lot of changes because our community is more open to these conversations, which I think is benefit. It's where we start from. 'Cause,
Conversation.
yes, once we're able to acknowledge, you know, that these things exist in our community and not just, you know, put it to
Brush
the
it
side,
under the
brush
rug.
it right, and then start talking about, well, how do we, you know, work to solve these issues in our community? What are the steps do we take? How can we be of support to people in our community who are dealing with these challenges? And then, you know, I believe we're able to do way more better, but it starts from having the conversation. It starts to being open to talking about it, and then also just, you know, working together as a group to be able to support. So as far as collaborations or projects I have done in the past, I've supported a lot of various of organizations that have, you know, not just towards mental health, but like have been raising funds or supports for
The less
you know, the
privileged.
less privileged, vulnerable populations here in the U.S. and also back home.
In Liberia.
In Liberia.
In Liberia, I get
Yes.
that.
In Liberia. So yes, I'm proud to say that you know, I've been a part of a lot of projects, helping little girls go to school.
Ooh,
yes.
okay.
So and
Okay, we have to
also
talk.
just supporting in monetary ways, however way I can be of support. If I can be there physically, if I, you know, make
Financial,
contributions, financial contributions and things of that nature.
Okay, you
Yeah.
hit my heart
Yeah.
when you said sending little girls to school, because as you know, this is a women empowerment center
Right.
ministry.
Right.
So little girls encompasses they're going to grow to become
Become
women.
women.
So it's important that we invest into them
Yes.
coming up,
Their foundation.
their
yes.
foundation.
Yes.
So how do you do that? Have you partnered with a group in Liberia, or you just do it upon request? Somebody needs help.
Yes. I haven't directly partnered, but I don't consider myself like a famous person or anything.
are,
but
you're
for some
helping.
yes,
Yeah.
for some reason I've been fortunate enough for a lot of people who were involved in these projects to reach out to me directly, and where they will be like, "Love, I think we could use your help," and that's how I've been able to show my support to groups that have been running these projects.
Okay. Have you ever given it thought to open a not-for-profit for little girls?
Yes, the idea have come up. I've thought about it.
Well, just do it.
Yeah.
You're doing it now. And that would be a legacy for your daughters and your
Yeah,
son and
yeah.
your nieces and your nephew.
Yes.
You know, it's always good to have a great idea.
Yeah.
And it's good to help people.
Yes.
But sometimes the dream that God puts in your belly, we need to live those dreams.
That's true. I agree.
I'm a helper.
I agree.
I will help you to the end of the world.
I agree.
But sometimes you have to go ahead and live your
Live your
dream.
dream.
And I employed you as your auntie
Yes. Thank you.
to
Thank
pray
you.
with
I'm
that,
so
and I'm
honored.
here to
Thank
help you.
Auntie.
Whatever I can do,
Yes.
I'll help you
Thank you so
to get it
much.
started. I don't know much about Liberia, unfortunately, but I went with my sister Zoe.
Right.
May she rest in peace.
Amen.
And the family said to me, "Oh, she's not here now, so we know you're never going back." Well, love is here, so I'll go back with
oh,
love.
yes, yes.
I'll definitely go
yes.
back with you.
And we can partner and
Definitely.
get that done.
Yes, let's talk about, you are famous.
Okay.
I witnessed you being, you were just
so
installed as an official
Okay.
in the Liberian
Liberia
organization.
Yeah.
So let's talk about that. What is your position? And let me see, what did I say here? You were sworn into the office of the local National Liberian Organization with my friend Wellman,
Yes.
who's your president.
Yes.
Wilma and I share the same birthday, September 8th.
Oh, wow.
Different years,
Okay.
but different, the same date.
Yeah.
Give us a little insight on the purpose of the organization and your position and what is your role.
So just to start off, our president, Miss Wilma Red, she's an amazing person.
She definitely is.
Yes,
Yeah.
she's an amazing person. So she reached out to me. Like I was saying, sometimes people reach out
People
to me
know
for
you, girl.
different things.
They know you.
Yes, so she reached out to me, and I was, honored to work with her. So I served one term with her in last year, the year before this year. I ran as her general secretary.
Okay.
Yes, and we won the election then. And then the second term was what you had witnessed on Facebook. Yes, because the first term we didn't post. We didn't have the opportunity due to COVID to do a
Opening.
official.
Yeah, my friend,
inauguration
Vice
ball.
Chair Walla did the installation.
Yes,
Yes.
yes, yes. So I'm just happy to be placed among these great people, great women who are influential. I learned a lot from the president, Ms. Red, and she has been nothing but inspirational to me. And I admire her strength. I admire what she's doing for the Liberian community. However way I can be of support, I always try to be as close as possible. And as far as what the organization is doing, the organization has really played a vital role ever since Wilma and Pearson regime as president and vice president of the Liberian Association. We have had outreach programs where the president herself was in Liberia doing community service back there, making sure the Zogos, as we call them in Liberia, were getting their COVID vaccine.
What is the Zoco?
So Zogos is a group of young males.
Okay.
I'll consider them as vulnerable population in our country. Some of them did experience the war, and they
Mental health.
Yeah, some dealing with mental health, substance abuse, all of that, and some are even victim of being child soldiers. So yeah, they're. I don't like calling them Zogos, but that's.
What does Zoco mean?
Honestly, that's a good question.
It's a slang.
It's a slang. I
slang.
think it's a Liberian
Okay.
slang. I really never looked into it to try to figure out what Zogo mean, but that's how they're commonly referred to. Yes, and I think the name Zogo also is like a stigma that attached to that population. However, that's another story for another day.
So you guys are hands-on administration.
Yes.
You go out and you touch the people.
Yes.
You impact their lives and you make a difference.
Yes.
Yes.
I wasn't on that project with the president. However, she had a team that was put in place, and she
Ahead of her.
Yes, and
Okay.
she led the team herself. She was on ground, and she was there.
She has a lot of
making sure-
experience.
Yes, yes.
She's not a novice
And
in leadership at all.
Yes,
Yeah, she
she's
has a lot of
very aware
experience.
of what she needs to be doing, and I applaud her a lot. And I think the Liberian community is very blessed to have a president like her.
Yeah, she has a family legacy. Her
Yes.
father, I've known the family for a long time.
Okay, okay.
So let's talk about your international traveler, your husband. You empower young women just by being who you are.
Thank you.
You're young, under 40. You have a successful marriage.
Thank you.
You have children. You're raising godly children.
Thank you.
You've accomplished a lot.
Thank you.
I have one little pet peeve with you. So, you know our family, right?
Yes.
Okay. So we had Sukuni,
Yeah.
Rochelle,
Okay.
Edwina,
Yeah.
Love.
Yeah.
So 3 of them are doctors. When are you going back? And that was a
Thank
joke.
you,
We
thank
had a
you.
joke.
Yeah.
We had
thank
a
you.
joke.
Thank you. Thank you for putting me on the
Yeah.
spot.
So you need to
Yeah.
let me know when you
Yeah.
start.
Yes. I definitely plan on going back. That's a promise I made to myself.
Definitely.
I'm just finding the right time.
The right time.
Yes, because right now I'm consumed with family, family life, children,
Mm-hmm.
and just also trying to enjoy my life.
And your marriage,
Yeah, my
too.
marriage, yes. And thank you for saying that because I feel like I'm happily married.
You are. You're a good son. You guys travel.
blessed
Tell
with a
me,
good husband.
you went to Europe. I remember one time you guys went to Europe somewhere. I was seeing the pictures. I didn't go, but so what is your favorite? What's the most exotic place you guys have been, and why?
So I think I'm gonna go with Phuket, and that's in Thailand.
I was going to say Thailand.
Yes.
I remember you brought some stuff from Thailand. Yeah.
Yes. So I thought the place was amazing, and I had a fantastic time. My husband visited that country way before I did, and he said, "You know what? I think that's a good place. You'll like it
vacation.
good for vacation. So I think we should get away." And I went there with him, and I enjoyed everything.
You trusted him.
Yes.
Like you're supposed to.
Yeah,
That's
like
your
I'm
king.
supposed to.
That's
Yes,
your king. Mm-hmm.
Yes, he is. So we went there, and he made the trip even more amazing. Where we stayed from. He took me out to hang with the locals. All of that. It was just amazing. I shared some of the pictures on my Facebook
I saw
page
them.
at the time. And I was just trying to share like the amazing time and experience I was having in Bangkok. Sorry, Thailand.
That's a long
Phuket.
flight. How
Yeah.
many hours?
So we flew to Korea, and then we transited, and then we flew to Bangkok. So from here, there was 14, and then we did 5 from Korea there. So
24 hours. Let's
yes.
just, when I say she's an international travel, there you have it. And you're probably wondering why we do this takeaway. We do what the topic is about. We give you the nuggets, the educational piece. But every person that comes on this show has a personal side, and it encompasses who they are. For the young women out there that are listening and says, "Oh, I want to be a social worker. I want to get my bachelor's and my master's and my PhD."
Right.
She's going to get that. You get all those things, and then you can live the life that you want.
Yep.
She couldn't do those things if she did not get that education,
Right.
and God didn't bless her
Right.
with her husband.
Right.
So, our takeaway as a mental health expert, what are the 3 things that you want to leave our audience with when it comes to mental health? And elaborate as much as you need to.
Okay. So what I would say to everyone, especially young people, it's okay. It's okay because we all have mental health issues. It's okay to reach out for help when you feel like you're not in the right space or you're not feeling good. It's okay. Because, we're so busy. The war has programmed us to just be activated to move.
The mundane things, just running.
We're just running. We're running. And there are times that we forget to take a break and check on ourselves. So you want to do those mental checks with yourself. You want to make sure, that you're doing okay. As much as you want to wake up and go to your job and be, a good worker and be efficient and be as effective as possible, you also want to make sure that you as a person is okay. So I personally practice a lot of self-care, which I think has helped me over the years because
Because you look good.
thank you.
You look fly.
Thank you. Yes, because, we're faced by too many different challenges on a daily basis. So you always want to make sure you're checking in and you're making sure I'm okay because you cannot pour into other people if you're not okay.
Definitely.
You'll not be able to help anyone if you are dealing with your own issues that
Definitely.
you have not addressed. So that's one thing I'm gonna look into these cameras and tell my
Your fellow women, yes.
women that it could be marital issues, it could be personal issues, relationship issues, issue with children, whatever the issue is. I'm a religious person and I believe in God, so I do seek, God in everything that I
Definitely.
do. However, it's also okay to seek mental health care if you feel like you need it.
Definitely.
If you feel like you're dealing with a lot, you might not have mental health issues. Maybe you're just overweighing with a lot of stresses that you can't manage at a time. Seek help. It could be therapy. It could be anything of
Reach
that
out.
nature. Reach out. If church is it for you, go to church. If it's seeking mental health
Counseling.
counseling or therapy will be something you'll consider, I strongly recommend that you do that. But we have to find that place where we're safe and we can go and address our issues.
Definitely. Wow. This has been a wealth of information. Like I said earlier, this is covered during Mental Health Month. It would be aired a little later, but we're just grateful on behalf of Dr. Flora Gooden Davis, who's not here. She's the host and founder of Living Spring Women Empowerment. This is her vision that the Lord laid on her heart.
Okay.
And He allowed me to be a part of it to help her get the jump start. She's coming up to a year of doing this day in and day out. It's not funded. So she's seeking funding. So if you're out there with some money, send it our way. We just want to say thank you. We have a gift for you, but I think I neglected to put it down there. Normally we have it down there. I'll get it to you. And that's her way of saying thank you for coming and helping us to empower women and young girls. With that being said, I would ask you to do me the honors of just saying the closing prayer, whatever the Lord lays on your heart.
Oh, okay. So before I say the prayer, I just want to tell you thank you so
Aw.
much, my auntie, my beloved auntie.
Of course.
And I'm so honored to be here with you, sitting here and talking about how we can, take care of ourselves, our
Definitely.
mental health issues. And thank you to, again, the Living Spring Women
Dr. Flora, yeah.
Empowerment, Dr. Flora. Thanks for having me on the show. I appreciate it. And I hope, we can raise more awareness on our mental health
Definitely.
issues. Yeah, thank you so much.
It's going to be an annual thing
Okay.
because we're going to do trending topics. That's
Okay.
that's her vision.
Okay.
To do trending topics, and all the shows towards the end of the year is relationship,
Okay.
type
Okay.
show. All righty, and we're going to collaborate on that
Okay.
Girls Foundation.
Thank you. Thank you
Yes.
so much.
Okay.
And let's pray. Father, we thank you for having us here today. Thanks for this opportunity. Thank you that we're able to gather and talk about things that are well-meaning in our society. We thank you for the openness. We thank you that we can have conversations that we once couldn't feel comfortable having. We thank you for this opportunity, and we pray that this ministry will be blessed. Thank you for your blessing you have poured on us, and may we be a blessing to our community. In Jesus' name.
Amen, my baby. You pray that prayer.
I try.
Yes, thank you for watching, and we'll see you next week.
you,
Bye
viewers.
bye.
Bye-bye.
Bye bye.
You're a chosen generation. We've been called for to show His excellence. Hey, all I require for life, God has given me, and I know who I am. We are a chosen generation. We've been called for to show His excellence.